Hello, I'm Senator Reverend Raphael Warnock from Georgia.
And I'm Senator Alex Padilla from California. Happy to be here with my friend, my colleague, Senator Warnock, to discuss an issue that's important to both of us.
Absolutely.
The maternal health crisis in America. And to talk about a bill that we're working on together, the Kira Johnson Act, which seeks to address this crisis.
Senator, can you begin by telling us who Kira Johnson was?
Yeah, Kira Johnson, constituent was from Los Angeles, a 39-year-old young mother. After a scheduled cesarean for her second child to be born, was victim of some bad medical attention, ended up passing away, leaving her two children and a young family behind. And I think her case is just so emblematic of the discrepancies in healthcare, particularly for women of color and young mothers of color, that we're seeking to address in this bill.
So we've seen up close the tragic implications of the maternal health crisis. Black women are over 3 times more likely to die during childbirth or as a result of childbirth than their white counterparts. And I think Kira Johnson is an excellent example, because here is a woman with means, with insurance, and still you see this disparity. Right. And so it's something that you and I have both been very concerned about, which is why we are addressing this issue through legislation.
Right. Well, as you mentioned, her family did not hesitate to speak up, and that was great, because whether it's health care and making sure doctors meet our needs, or in the case of a young mother, things like postpartum depression and other issues, it's something that we need to talk about more.
Absolutely.
So Kira's from California. You represent Georgia. What's the situation in Georgia?
Georgia's emblematic of the problem. We see this huge gap in care, and we see a difference in the standard of care for Black women, women of color, and their white sisters. And so as a result of this, we see tragic cases like Kira Johnson's all the time in the state of Georgia. And I just think it's so very important for us to address this, which is why you and I have introduced legislation, the Kira Johnson Act, to speak to this issue.
I'm excited about this bill.
Sure.
Because I know that it's going to put resources where they're needed,
right,
to address that discrepancy in health care, but also to provide mothers the support, including mental health support,
right,
that they need at such a critical time, and encourage not just women who we a lot of times kind of just defer to the mom to be concerned about health care for our families, but to get men and men of color caring about this and talking about this as well.
Right. And the issue of postpartum depression that you raised is so very important. And it's not uncommon at all for women to experience postpartum depression. It's something we don't talk nearly enough about. And I think it's important for people to know that to seek care and to create communities of care where folks who are giving birth feel supported is not a sign of weakness, it's a sign of strength and a sign of beloved community. So honored to do this work with you.
It's great for all families.